Please come in.
Hi.
Hi.
Serving Ames.
Hi, Mrs. Ames. Pleasure to meet you. Please have a seat.
Thank you. Same to you.
I'm Dr. Charles Taylor. I'm a specialist in diabetes. And do you know why you're here?
I come here to get a check. Get a check out.
A check out.
With my sugar level and stuff like that.
And your sugar level. Was it told that you're going to be started on insulin today?
No, please.
No, please. Okay. But your doctor did discuss that you need insulin.
Yes.
Okay. I have been asked to start you on insulin today. Are you willing for us to do that?
Yes.
Okay. So I'm going to go through the process of starting you on insulin.
Yeah.
And what's very important is for you to understand insulin and how to use it and its possible effects.
Okay.
So we're going to cover a bit of educational material, right? What's most important is that you understand, okay? So feel free to stop me at any point and ask any question.
Okay.
Okay? No question is too simple.
Okay.
All right? So the first question I'm going to ask you is, do you understand what insulin is?
No, I only understand is that it's to help lower your blood sugar level.
It helps to lower your blood sugar. So the classic analogy we use is that it's like a key. And it opens the door that allows sugar to move from your bloodstream, blood vessels, into your tissues like fat, muscle. And that will allow the blood sugar level to come down. Okay?
So if it's in the blood, it is very harmful if it's in the blood.
Exactly. If it's in the blood, it's harmful because the levels are elevated and it causes damage.
Okay. So what sort of damage it will cause?
Well, it could damage quite a number of areas. It could damage the eyes, and in its extreme form lead to blindness. It could damage the kidneys, and in its extreme form lead to kidney failure. It could damage the nerves in the legs, and that could lead to ulcers and even amputations. And insulin is a drug that, once used correctly, could bring your sugar down to normal. Okay?
Which is the best to use, the tablet or the...
Well, you are at the stage where the tablets aren't working anymore.
Okay.
And you need insulin.
Okay.
So I have a little form here, a little checklist. It's really designed as patient information so that you would be able to refer to it. I'm going to give you a copy when you're finished. You'll be able to refer to it to remind yourself of some of the educational points that we're going to cover over the next few minutes.
Okay.
All right?
All right.
So while we talk, we will be going through it and checking off certain items from the front, and there's some images and instructions at the back that we will go through. Okay? Well, first of all, let me write your name in. So it is Mrs. What's your first name again?
C-Y-R.
C-Y-R.
L-E-N-E.
L-E-N-E.
A-Y-M-E-S.
The device we're going to use for your insulin administration is a U100 syringe. Okay? And this is what it looks like. I'll spend some time going through this a bit more. So I'll take that off. It's a 31 gauge. 31 gauges refers to the size of the needle. The needle is actually quite a small needle. And I am going to inject myself with it during the course of the consultation to prove to you that it's actually a small needle, and it's not that
big,
uncomfortable at all to use in terms of injection. All right? Now, the first thing I will say to you, the first thing we'll check off on the list is the fact that insulin lowers blood sugar level. Okay? But we have to be mindful of the fact that we are giving you a dose. And once it's in your system, it's in your system. And it's different from your body producing it because if your body was producing it, it could recognize when it needs to shut off.
Okay.
Okay? But if you take a dose and that dose is a little more than you need on that particular day, there's a chance that your blood sugar could actually go low, which is called hypoglycemia or hypo. All right?
Okay.
And we'll talk a bit more about that later on and how it's treated. So that's one possible side effect of using insulin. Another one is weight gain. And the reason for weight gain is actually quite simple. If you have a lot of sugar in your blood, it means the calories that you've taken in is in your blood. Okay?
Okay.
When you take insulin and that sugar gets into the tissues, the calorie gets into the tissues. So most patients will get on average around 2 kilograms weight gain. The way to tackle that is to decrease your portion size, because now you're getting more sugar into your tissues. You don't need to have as much sugar in your body. So you could decrease the portion size on your carbohydrates. Okay? And that should help. I'll talk to you a bit about the syringe. Okay? So firstly, when you're doing the injection, you have to inject straight into the skin. Okay?
So you could, it's either you could use it on your hand, or it's only on the hand only, or you could put it in any other part.
Well, we're going to talk about injection sites. That's a very good question. We're going to talk about injection sites. But I want you to be clear on the fact that you inject straight. You don't have to go at an angle. Okay, so you could, wherever you're injecting, and then we'll get back to injection sites, let's pull up a pinch of skin, and you'll be injecting straight into the skin. And when you deliver the insulin, you then count to 10 before you pull the needle out. Okay? So that allows the insulin to be properly deposited. Okay? And when we get to the back of the sheet, we're going to talk a bit more about rotating sites. So we're going to come back to injection, but for now, I want you to remember that point. You're injecting straight.
Okay.
In.
So if you inject slant, what will going to happen? The medication is not going to work the way it's supposed to work?
Well, it may not, because it may not end up where you want it to end up. It has to go into the subcutaneous tissue. We don't want it going into the skin. Okay? So that's something to bear in mind. When you use your syringes, it's important that you dispose of them in a plastic container. So you get an old bleach bottle or some form of a bottle, and you put them in there, or else you put the garbage collectors at rest. And that could be brought to the hospital for incineration. Okay? In terms of the storage of insulin, a vial that's in use could be kept at room temperature. Okay? Vials that you have that's not in use, you keep in your fridge. Okay? But not the freezer.
Okay.
Alright? And once you've opened the insulin, you have a month to use it.
Okay.
Before you have to move on to another
bottle.
Another bottle. Okay? 28 days. In the event of a hurricane or storm, be prepared to store your insulin in a cool place. Okay? Some sort of ice pack container.
Okay.
Now, in terms of testing your blood sugar, we're going to start you on an insulin called Novolin N. Okay? When we think of the insulin requirement that someone has, we could separate that into two categories. You need insulin for your food, okay? So you're taking sugar, carbohydrates with your food, you need insulin then. But you also need insulin when you don't eat to help control the production of sugar by the liver. So if you were to fast for a week, your body will still be producing some some insulin. And that insulin is what we call background insulin. Okay? So we are using an insulin that acts in a background type manner. Okay? It hangs around in the system and keeps pushing your blood sugar down. Okay? So let's write that here. When it's to be taken, it's to be taken at bedtime. Okay?
Only at night?
Only at night. And at bedtime, preferably.
Okay.
The reason why it's preferable to take it at bedtime is because although it's an insulin that's meant to just hang around, it does have a bit of a peak. And that peak happens at approximately 10 hours. So if you do some maths, if you take it at 6, that peak will happen around 4 a.m. in the morning when you're sleeping. Okay? And that peak could potentially put you at risk of having a low blood sugar. But if you have it at 10, move that down 4 hours, that peak happens at 8 in the morning when you're up and around, and if you have a hypo, it could be treated. So it's very important that you take this insulin at bedtime. In terms of testing of your blood sugar, do you have a meter?
No, I don't.
You don't have a meter? Okay. So when I'm finished with this, we'll get you a meter and we'll teach you how to use the meter.
Okay.
But in terms of the testing of your blood sugar, we would want you to test your blood sugar first thing in the morning. All right?
So you can't test it during the day?
You can't test it during the day to get a feel of what's happening with your blood sugar. But the times that I definitely want you to test it is first thing in the morning, okay? And if you think you're having hypoglycemia. And we'll talk a bit about what will clue you into if you're having hypoglycemia.
Okay.
So, as we said, a hypoglycemia is a low blood sugar level. And when we teach you the meter, you would realize that you get measurements of your blood sugar. And what we want is your blood sugar never to be below 4. Okay? We try to help you remember that using the statement, make 4 the floor. Okay? Now, that is not saying that it would not happen. Okay? Hypoglycemia is a real possibility, but the aim is to keep it above 4. All right? And when you measure it first thing in the morning, you want it somewhere between 4 and 7. Is the ideal target for it to be at first thing in the morning. Let's read through the statement. A glucose of less than 4 is low and should be treated immediately. Okay? And that's very important because if you don't treat it immediately, your sugar will continue to fall. So if you're in the garden and you're feeling like you're having a hypo and you said, all right, I want to finish this, what could happen is your sugar could continue to fall, and by the time you get around to treating it, it could progress to the point that it's so low that it's affecting the way your brain functions. And if you get to that level, you can't treat yourself.
Okay, so what is the possible effect of that when your sugar level is that low? You can go in a coma or you can... Okay,
so that's a very good question. So let's talk a bit about the symptoms, and they're recorded here. The symptoms of low blood glucose include feeling hungry, feeling anxious, feeling sweaty, feeling trembly, shaking. For some people, it's a change of mood. They get angry, they get upset, right? But you may have symptoms that are unique to you. So if you feel in any way off, you check your blood sugar, make sure it's not low, right? These symptoms are the early symptoms.
Okay.
So this is when you want to get your treatment in. From there, it goes into affecting your brain. And you could be less conscious, become confused. And in its worst, or at its worst, you could actually go into a coma and lose consciousness because the brain is totally dependent on sugar to work, to function. Okay? So just to reiterate, the key thing is to treat blood sugar once you get the symptoms. Okay? So we're going to talk a bit about how you treat a low blood sugar. But before we do that, I'll pause and ask, do you have any questions? Are you clear thus far?
Yeah, I want to know when the sugar level is so low, if you can drink something to bring back up the sugar level, or you could eat a milk or whatever.
So that's a very good question. So if you have a low blood sugar, the treatment is to get 15 to 20 grams of sugar into your body. Okay? And there are many ways that you could achieve that. If you look at the sheet we have written here, you could use 120 mils of regular fruit juice. Okay? So that's just about a half of a Pine Hill Dairy juice. So if you drink half of that, you will get enough sugar. The other option we have here, you could have a full glass of milk. You could actually take 3 to 4 teaspoons of sugar and dissolve it in water and drink that. Okay? But what you could also do is any drink you like, look at the information on the sugar content, and you could calculate how much of that drink you need to get 15 to 20 grams
of sugar.
Okay? Now, the important thing is not to over-treat when your sugar goes low, because the tendency is, I just want to get sugar in, I want to eat, I want to get this sorted. But if you then have too much sugar, you go the other way, and your blood sugar will go high. And sometimes you get caught in this vicious cycle where you feel, you give sugar is high, you have to give yourself some insulin, and then it goes low again, and then you give yourself too much sugar. So it's very important to try to get the right amount in. All right? So you give yourself that sugar, but that's not the end of the story, because you now have to make sure that it works. So you wait 15 minutes and you repeat the measurement to make sure it has come above 4. If it hasn't, you retreat using the same amount of sugar. Okay? And you do that up to 3 times. If after 3 times it's still below 4, call the ambulance and come into hospital.
So you have to be at 4 and a little bit over.
You have to be over 4. Over 4. The next thing that is important is that if you're successful in your treatment, you need to think about when is your next meal, because you're still vulnerable for it to drop again. So if you have your next meal more than a half an hour away, it's advisable to have some form of a snack, a half of a sandwich or something that will give you more slow release sugar to keep things on a level until you get to your next meal. Okay? Another important thing to be aware of is that insulin brings down your sugar, and your brain needs sugar to work. Okay? So, you drive?
Yes, I do drive.
You should check your blood sugar every time before you drive to make sure that it's more than 5. So we say your sugar should be 5 before you drive. Okay? That gives you a cushion to make sure that you don't go low while you're driving.
Okay.
Okay? But if you do go low, or you feel you're going low while you're driving, you need to be prepared. So you should always have in your car some form of carbohydrate for immediate treatment, some sort of juice or something like that, as well as a snack that you could take if you do have a low. You could follow up with that snack.
Okay.
The next important thing to remember about driving is that it takes an hour for your brain to reset after you have a hypo. Okay?
Okay.
So you should pull to the side of the road if you think you have a hypo. You should get into the passenger seat, take the key out of the ignition, do your measurement if necessary, do your treatment, and give yourself the hour to recover, and then you can drive. Okay? Now, in terms of the tablets you are on, you were previously on diamicron, 60 milligrams once a day, as well as metformin, 1 gram twice a day.
Yes.
You're tolerating the metformin, okay? You don't have symptoms with the metformin?
No.
No diarrhea, abdominal cramps. Okay, great. We will want to continue the metformin. One useful thing about the metformin is that it increases the total dose of insulin that you will actually need.
Okay.
The sulfonylurea actually acts by, I would say, squeezing the pancreas to see if it could get it to secrete some more insulin.
Okay.
So since we're giving you the insulin, we're going to stop the diamicron. So I'm going to write here tablets to be stopped, diamicron. Okay?
Okay.
So now we're going to actually go into the process of drawing up insulin and administering insulin. Alright? But before we go into that process, I want to just show you the syringe. And as I said, I'm going to inject myself with the syringe for you to see how easy the process is.
That would be really sharp.
So, you see I removed 2 caps, one from the needle and one from the top.
Yeah.
If you look at the syringe itself, you could see that it's in tens. But if you look between the tens, you could see that there are only 4 marks. So there's 1, 2, 3, 4. Okay?
Yeah.
So that means that for this syringe, each mark is 2.
It's 2?
Yeah.
Okay.
Alright? So it goes 2, 4, 6, 8, 10. And it continues up to 100. Okay? So that's very important for you to check, because sometimes you get syringes where each mark is 1, in which case you should have 9 between between the tens. All right, so you have to check that. You can see the needle there. It's a short, very slim needle. This is the plunger. Initially it's a little hard to pull back on, but when you're drawing up the insulin, you pull back on this plunger. Okay? Now we're going to talk about the sites you could inject. One of the sites is the abdomen. Okay?
Yeah.
So, pardon having to look at my tummy. But when we inject, as we said, you could pull up a fold of skin and you just go right in.
Oh, okay.
You see how simple that was?
Yes.
It's so simple, I'll do this again.
Oh, okay. I see.
You believe it's easy?
Well, I will have to get practice.
You have to get practice.
Right.
Alright? But since 3 is a nice number, let's do it one more time. Very simple.
Oh, yeah.
No pain. Alright?
Okay.
So that's the process of injection. You would see that I went in at 90 degrees.
Yeah.
And we mentioned that when you're actually delivering the insulin, you keep it in for 10 seconds. So you count to 10. So I'm just going to put this aside because I've used this. And I'll pick out another one. So this is the insulin that we're using. The first thing you notice is that it's cloudy.
Yes.
Right? And that this type of insulin will always be cloudy. You expect it to be cloudy. Okay?
It's supposed to be cloudy all the time?
It's supposed to be cloudy.
Okay.
All right? That's point number one. So when you get your vial, you want to make sure that it hasn't expired. So you go looking for the expiry date, and you could see here that it's the 1st of 2016. So we know the insulin hasn't expired. All right? The reason the insulin is cloudy is because it has components in it to make the release of it slow. Okay? One of the things you have to do, and that's number 2, is to gently mix the insulin. And you can do that by just rubbing it together with your hands. Well, this is gentle to and fro shape. Okay? If you then move on to 3, the next thing you have to do is remove the cap from the vial. And you could see this soft area, rubber area here where the needle will go in. Alright? So let's just rest the vial here and get out the syringe. And we'll go through how you draw the insulin out. So, we're starting here on 10 units. It says pull back the plunger with air to mark the required insulin dose. With the bottle standing upright, insert the needle straight through the center of the rubber cap and push the plunger down. Okay? So you are going to be on 10 units of insulin. Do you want to try to see if you could pull the plunger to the mark of 10? You have to pull hard initially and find 10. Fantastic. Right? Now I'm going to ask you to pull it to 14. Okay? Remembering each graduation is 2. Let's see what you've done. So it is at 13. I don't know, you managed to achieve it. It's just in between. So you just have to pull that a little more there, and you would have had the 2. You see?
Yeah.
So that would be 12, and that would have been 14. Okay? So I'm going to put it back to 10, because as we mentioned, 10 is the dose that you're actually going to be using. So it says you keep the bottle up, you insert the needle into the rubber. In fact, I should get you to do this. Insert the needle into the rubber.
In the middle?
Yeah. That's fine. Just straight in. Good. It's so easy that goes in. And now push down on the plunger so that the air goes into the bottle. Okay? Alright. The next thing you do is to turn it upside down. So you could hold it. And you will have to get used to how you want to pull the plunger down. Use your hand to pull the plunger down. And what you're trying to do now is to pull 10 units out. Okay?
Okay, 10.
What you could do is go past 10 initially.
Okay.
Alright, so just pull until you go past 10. And then adjust it back up to 10.
Okay, okay. Right here's 10.
That's right. So, oh, you pulled it perfectly to 10. Now, what we need to do is you could take the needle out. Let's have a look and see if you have any air bubbles. And you can see there's an air bubble there. You see that? So you could knock the syringe and actually push that air bubble out. Okay? So it's being a bit resistant. Okay? And let's now go back and do the same thing. Turn it upside down. You don't have to put the air in again. But let's now get back to 10. Let's pull to 10.
I think it gone over 10.
So let's adjust it right to 10. Perfect. You're natural. Alright? So now you have the 10 units of insulin that you're supposed to be on in the syringe. Alright? And we have gone through the process of removing the air bubble. So you're ready to administer the insulin. Okay? Let's talk a bit about injection sites. We have some diagrams here to show you where you could inject. You could inject into your tummy, the size of your tummy, like I just did. You could inject into your thighs, like I just did. You could actually inject into the side of your arm, so although that's a bit more challenging, okay? The best place to inject actually is in your thighs. Because the absorption is slower in your thighs and a bit faster in your tummy. And the way this insulin works, we want it to be a slow
working process.
Exactly. But there are some key points about your injection sites. You need to remember to rotate within and between injection sites. Okay?
So they're taking it one place all the time.
Exactly. You don't keep going the same place. Okay? You could use the leg and rotate different places in the leg. And you could rotate across legs, right? But don't keep going in the same place. The reason for that is that if you do that, the insulin actually stimulates the production of fat in the area you keep injecting. And over time, you could develop what we call lipohypertrophy. Okay? All that means is that there's a lot of fat in that area. And when you inject in that area, the absorption is slowed. It's slowed down. So you may get used to a dose in that area and you inject it and it's absorbed at a slow rate. And then you go into a good area and then it comes to you faster and puts you at risk of hypoglycemia. The next point is to avoid injecting into your legs if you have exercise. Okay? Because then the blood will be flowing quickly through the subcutaneous tissues and the absorption would be faster. Lastly, in terms of the injection, whatever sites you're using, you constantly inspect them and see if there's any depression or swelling in those areas that may suggest that you're developing this lipohypertrophy. Okay? So you keep inspecting your injection sites and you make sure they're fine. Alright? Now, as far as administering the insulin, we have covered what you need to do. You just need to use one of these sites, preferably your leg, pull up a fold of skin, injecting, right angle, count to 10, pull it out. And you finish. Okay? Quite straightforward. So, do you have any questions about that process?
If you don't count to 10, what would happen? So many medication would be inside the syringe?
Yes. What happens sometimes when you don't count to 10 is that when you pull out the needle, the insulin comes out
Okay.
of the injection site because it hasn't had enough time to go into the subcutaneous tissue. The important thing is you have this now as your own sheet. I'll sign it and date it. Okay? So you could go back to this at your convenience. Okay? If you want to double check anything, it's on the list. Okay? Additional to that, we have it as a YouTube video. So you could go on YouTube and I'll give you what you have to search for and actually look at the process again. Okay?
Okay.
If you have any issues at all, you contact us and we would address them. Okay? I would like you to come back to see me next week to see how you're getting on with it.
Okay.
Is that convenient for you?
That's convenient, yes.
Right. So that's it.
Thank you.
Thank you for coming. It has been a pleasure meeting you. All right? Take care.
All right.